Be a monumental error for any country to think the danger has passed. The tailored and consistent use of public health measures in combination with equitable vaccination remains the way out.
So vaccination numbers in the U.S. look good, not great, but they look pretty good. Things are opening up across the country. What's your concern? You think that applies to the U.S.? What's your message to people who are feeling good, maskless out on the beach this weekend?
Absolutely, that applies to the United States. And really, it does concern and scare me because we think that we're isolated. We think that just because things are better here, that it's over. And I agree with the Director General, that would be a monumental mistake. Let's face it, this pandemic is probably going to stretch out for another couple of years, at least in one way or another. And just because it stopped sprinkling here in the United States doesn't mean that there aren't storm clouds on the horizon. There are. And until all countries have this contained, seriously, no country, no person is safe because we're not isolated. We travel, there's commerce. So it is a monumental mistake, especially when we have this opportunity to take vaccines and protect ourselves. And so many people are not taking advantage of that it's just insane and it is a mistake.
Another couple of years. That's what I heard you just say. This is going to go on for another couple of years. Doctor, go ahead.
No, I was going to say in one way or another, I mean, we keep thinking that it's just the United States. There are countries that are just, completely exploding with COVID, and people are going to be traveling to other parts of the country and to other countries. So listen, unless this virus just decides to evaporate into thin air one day, we're looking at a slow burn. And we have the opportunity to contain it, at least in this country. And we need to share that wealth with less privileged countries so that they can contain it, so that we can be safe.